This is an overview of shock assessment and treatment. For this presentation, we're going to define shock as the inadequate delivery of oxygen to the tissues for whatever the reason. Shock can have several causes. One would be that the heart is not functioning, is not pumping blood around to the tissues. Or the blood volume could be depleted either from bleeding or dehydration. Another reason that oxygen is not being delivered to the tissues could be that ventilation is not adequate to bring in oxygen, or that ventilation is not bringing in air with sufficient oxygen in it. Shock could also be caused by situations where the vascular container, or the blood vessels as a group, that container has expanded to a much larger size than it should have, and therefore there's not adequate blood volume to fill up the container. When we talk about signs and symptoms of shock, there's essentially 5. In the first, although the most subtle, is an altered mental status. The patient will be anxious or restless. This is difficult to detect, but it is the first sign of low oxygen delivery to the brain. The next 3 essentially occur together, and they are signs to us that the body's compensatory mechanisms have kicked in. The body will attempt to cause the heart to beat faster, therefore tachycardia, will cause the respiratory system to increase its rate in order to bring in more oxygen, or tachypnea, and then the skin will become cool, pale, and moist, cool, pale, and clammy, diaphoretic in some cases. So these 3 are related to the compensatory mechanism being activated in an attempt to keep blood pressure at a normal level. However, if the compensatory mechanisms have failed to keep blood pressure at an adequate level, hypotension will occur. The easiest and quickest way for us to assess that is a loss of peripheral pulses. The patient will not have a radial pulse. We're not able to say what that blood pressure is, but we're able to say qualitatively that that is not a good blood pressure. So once we recognize one of those 5 symptoms of shock, our treatment for shock also has 5 elements to it. The first is to place the patient supine, and we don't use a head-down position with our Trendelenburger shock position. We simply place the patient in a supine position. The head-down position tends to impair ventilation, and we certainly don't want to do that. So step 1, get the patient supine. We also want to keep our shock patients warm. We want to help them maintain their body warmth. This is an often overlooked step in shock treatment. Because shock is inadequate delivery of oxygen to the tissues, we want to make sure that adequate oxygen is being delivered to the alveoli where it can mix with the blood. And we also want to facilitate a rapid and efficient delivery of the patient to definitive care. Shock is not treated in the field in most cases, and so rapid transport, efficient packaging for rapid transport, anything we can do to help facilitate a rapid transport of a shock patient is a critical thing for us to do. So while we're doing those first 4 things, we should also control what external bleeding that we can control and manage other injuries as much as possible. All these things are done concurrently. It's not necessarily a step 1, 2, 3, 4, 5. All these things can happen rapidly and at the same time. So that's essentially assessment of shock and treatment for shock in a very quick overview.